Today we're diving into our inner framework, our bones.
Doctora Victoria and George.
That's right, Doc. I've got a pun for you today. Did you know skeletons are calm and collected because nothing gets under their skin?
Oh, George. Speaking of bones, let's talk about something serious. Bone health. As we age, our bones can become more fragile. It's a condition called osteoporosis. And it's not just a concern for Senora Hueso, George's mom, but for everybody.
Mom's really worried, Doc. She's always been as tough as bones, but now she's concerned about becoming brittle.
That's understandable, George. Osteoporosis is more common in females, especially post-menopause. But it's not exclusively a woman's issue. Men are at risk too. It's often due to secondary causes like a medication or even lifestyle factors.
So it's not just a lady's problem. I guess men need to be more bone aware too.
Exactly, George. And for those at risk, we recommend that they get a bone density test, the most reliable of which is a DEXA scan. It's a fancy kind of x-ray machine that helps us to measure bone density at crucial points, like the spine and the hip.
What if someone can't lie down for the test, Doc?
That's a good question, George. There are alternative tests, like a peripheral DEXA scan, kind of like a CT scan, or even ultrasound for those who really just can't have a DEXA scan.
But Doc, what about men specifically? I heard something about testosterone in bones.
You're absolutely right, George. In men, osteoporosis can often be linked to hypogonadism, where the body doesn't produce enough testosterone. This can lead to weaker bones, and in such cases, we sometimes recommend testosterone replacement therapy to help improve bone density.
Ha, I used to have gonads. Now there's nothing down there. And are there other tests men should consider?
Well, definitely, George. We look at a range of factors, including blood counts, liver function, vitamin D levels, and even a 24-hour urine calcium test, among others. It's all about getting a full picture of bone health.
Sounds pretty comprehensive, Doc. So whether you're a lady or a gent, taking care of your bones is key.
Precisely, George. Remember, folks, bone health is crucial at every stage of life. So take care of your bones, and they'll keep you standing strong. Now, let's deepen in our understanding of bone health. George, did you know that our bones reach their peak density, that's how hard they are, around the age of 30?
Really, Doc? So it's all downhill from there?
Well, in a way, yes. After 35, bone breakdown accelerates. This is even more pronounced after menopause for women. By the age of 50, half of women and a quarter of men will be affected by osteoporosis.
Doc, where's my hope? I'm 35 now. What puts people at risk?
Well, there are several factors, George. Smoking, long-term steroid use, family history, being postmenopausal or of advanced age, sex steroid deficiency, and even lifestyle choices like low physical activity and excessive alcohol consumption. Not to mention, a propensity to fall increases the risk too.
I see. And you mentioned the DXA scan earlier.
Yes, that's the DEXA scan. It's a crucial tool. It gives us a T-score, and that's where we compare your bone density to that of a healthy 30-year-old, and a Z-score comparing you to others of your own age, sex, and size. These scores help us to understand your bone health in context.
And if the scores are concerning?
Well, then we investigate further. We check calcium, phosphorus, liver enzymes, alkaline phosphatase, vitamin D levels, and do a complete blood count. We use the FRAX tool to assess the risk of a hip or major fracture in the next 10 years. Doctors, we like these kind of predictive tools. Doctors sometimes talk about the risk of heart attack and stroke in the next 10 years, and we have a different tool called the ASCVD risk, atherosclerotic cardiovascular disease risk, and it tells you if you should be on a cholesterol-lowering medication. This FRAX, or Fracture Risk Assessment tool, helps us when it comes to our bone health. It's also vital to rule out other causes like hyperthyroidism, alcohol abuse, vitamin D deficiency, steroid use, physical abuse, malignancy, Paget's disease, hyperparathyroidism, and osteomalacia.
Wow, that's thorough. Make sure you hit the like and subscribe, viewers, so you don't miss out. And now, tell us about prevention and treatment, Doc.
Well, prevention is key, George. Calcium intake of at least 400 milligrams a day is crucial. And if dietary intake is poor, supplements of 500 to 1,000 milligrams in divided doses with meals are recommended. Vitamin D is also essential, with 800 international units daily being the standard. For those with absorption issues in the gut, higher doses may be needed.
And exercise?
Weight-bearing exercise for 30 minutes 3 times a week is beneficial, though it doesn't directly prevent vertebral fractures. That's in your spine.
What about treatment, Doc?
For treatment, we've got lots of options. Bisphosphonates like alendronate is often the first line. Patients need to sit up for 30 to 60 minutes after taking this medicine, and it's not suitable for everyone. People with severe kidney disease or who have had certain bariatric or weight loss surgeries, and treatment duration is usually 5 years, but it can extend to 10 years depending on what's going on for the patient.
Oh, God. Any other options?
Yeah. So if bisphosphonates aren't suitable, we consider medications like Reclast, used for up to 6 years, or alternatives like denosumab, especially for those with difficulty in oral intake or specific requirements. It's all about tailoring the treatment to the individual's needs, ensuring they get the right medication for their situation. Now let's turn our attention to a cornerstone of bone health, calcium and vitamin D intake, especially for postmenopausal women. George, did you know that your diet plays a huge role in maintaining strong bones?
I had no idea, Doc. I just thought bones stayed the same once you're grown.
It's a common misconception, George. Bones need constant nourishment. Women should aim for about 1,200 milligrams of calcium a day. And if you can't get that from your diet alone, supplements can help bridge the gap.
And vitamin D?
Vital for bone health. Like I said, that 800 international units is the daily goal. But some may need more, especially if certain medications or conditions affect vitamin D metabolism.
So, how can we ensure we're getting enough calcium in our diets?
Well, that's a good question, George. Dairy is a classic source. A single serving at each meal can do the trick. Think a glass of milk, soup made with milk, or cheese-rich dishes like lasagna. And for those over 50, aiming for 3 servings of milk or alternatives like yogurt or cheese is key.
But what about me, Doc? I get gassy from all those things. What if someone can't have dairy?
I know, George, but don't worry. There are plenty of alternatives. Calcium-fortified beverages like soy milk, almond milk, or rice milk, they can be good options. Don't forget about canned fish with bones like salmon or sardines. Those are calcium powerhouses.
That's reassuring, but it seems like a lot to remember.
It can be, George, but there's a variety of foods to choose from. For instance, a cup of fortified orange juice or plant-based milk contains about 300 milligrams of calcium. A small cube of cheese, say about 3 centimeters, can provide as much calcium as a cup of milk. And remember, skim milk products offer just as much calcium as whole milk with less fat and cholesterol.
What about non-dairy products?
Well, there's lots, George. So you can find calcium in leafy greens like collard greens, beans like navy or baked beans, nuts like almonds, and even tofu. They are all fantastic sources of calcium. The list is long, and there's something for everyone's taste.
This is eye-opening, Doc. It seems manageable to include these in my diet.
Well, absolutely, George. It's all about balance and variety. Who wants to eat the same thing every day anyways? And don't forget about that vitamin D. While it is harder to get from food, supplements can ensure you're meeting your needs. it can be helpful to have a supplement even if it's just in the winter months. And it is a fat-soluble vitamin. So if someone is obese, the vitamin D gets packed away in storage and it's not available for the body to use easily.
Got it, Doc. Here's to strong bones and a healthy future.
Cheers to that, George. And remember, folks, taking care of your bones is a lifelong journey. So include these bone-boosting foods in your diet and your future self will thank you. Want to learn some more? Check it out here. Or what about over here? Thank you for joining us today, our healthcare team. We hope that you'll join us next time. Bye-bye.